All right, it is December 1st, 2020. You have made it to the final month of 2020 as we continue to track COVID-19 with the very latest numbers coming out of Arizona for you. Today was a shocking day, and we understand that the case numbers that came out got a lot of attention, and we want to help you better understand what this means and how the 10,000 number is actually an outlier. We're going to show you some things to look at so you can better understand these numbers. I don't know about you, Garrett. I've been getting text messages and emails from friends and family all day going, what in the world is going on? We're going to walk you through all that today. So a lot to get to, and we are expecting some breaking updates throughout this hour. We'll have those for you as well. So first of all, Garrett, as we look at these numbers, it's a Tuesday, and so we used to see higher numbers come out. We let everybody know who joins us on here every day that this could have some anomalies coming in this week. So what do these 10,000 mean, and what should we be concerned about after we talk about the 10,000?
So yeah, we were expecting higher numbers today. I think everybody who's been watching this, AZDHS, pardon me, everyone was expecting higher numbers today.
Right.
It was a little shocking to see, but we were expecting these numbers. So 10,322 cases were added today. That is obviously a lot. It's more than twice any other report that we have from AZDHS on any given day. But here's very important to point this out. So I'm going to show you two graphs here. We're just going to step off this for just a second, and I'm going to show you another graph. And this is going to be the graph of what this looks like. Let me see. Okay, this is what you're looking at. Okay, this is the case reports from the AZDHS on a daily basis. You can see it, this is where we started out. This is that first summer surge, went back down. This is the little blips that came from the ASU, U of A, all the college kids coming back, and then there's a gradual uptick, and then obviously you have this massive outlier, much bigger than any of these other numbers, and that's today, and that's what it did to the system. So just keep that.
Yeah, reset the whole chart.
Reset the entire height of the chart. Yes.
Yeah.
So now keep that chart in mind. And now I'm going to show you, and I'm going to use the AZDHS's chart for this initially because I want to make a couple points with it. And this is the actual case epi curve. Same exact data, just all the tests are now placed on the actual date of occurrence rather than the date of report.
And by a date of occurrence, you mean date of collection, the date they actually went and got the swab or went and got the saliva test.
The date the test was collected. So as you can see, that massive 10,000 outlier is now gone. It doesn't exist anymore because it's been folded into about a week of data. Now, important to note, we are obviously now at a point where we had the epi curve shift. Our peak has been, since this day, June 29th, 2020, our peak was 5,451 cases. And then obviously you can see the cases by day went down dramatically after that. We are now looking at a new peak of 5,574 collected on November 23rd. And this is not a set day yet. This could still go higher. We could see this hit the 6,000 range. Don't know yet. Tests are coming in and being added a lot earlier or more recent. So this number will settle faster than we saw in the summertime. But right now it's at 5,500. I do expect that these numbers right here, this November 25th and all these smaller numbers, are going to be within this range by the middle of next week or so. You can see that because you can see the pattern with the rest of the weekly reporting, how last week everything sort of fell within a range of, you see 4,200 to 4,100 to 4,500 in that week. So we're going to get sort of that similar ranging with this week on this data. So we don't know what it's going to look like yet. Of course, we won't know till next week. But and of course, we also don't know if this is going to be our final peak or if we're going to continue upwards. We just don't know. But this is what we have right now. But this is very important to understand. All of that data got folded into the Thanksgiving week.
So, Garen, I'm looking at that. That highest number would be, if that's November 23rd, if I'm seeing that correctly, that's Monday. Yeah. There's been some conversation that a lot of the people who got tested last week were going in hoping to get a negative test to then go see their family. So it might have been more cases of people who were trying to do that versus what we're going to see in the test next week is people who are actually sick going and getting tested, who are actually exhibiting symptoms.
Yeah, this data would not have been from people that were at Thanksgiving dinner or went and traveled with family and got sick from that. That is not what this data is from. Like, as you said, Katie, this data would be from people who got tested just prior to Thanksgiving, and we're seeing these numbers now. So that's, again, important to note. That 10,000 does not include any sort of what could possibly be a surge from Thanksgiving. We simply just don't know yet.
Okay, so I see so many questions in the comments, and I want to get to all of them. One of the first things I can answer, and your comments are going by so quickly. We want to thank all of you for taking time with us on here to better understand all of these numbers. County by county, people are wondering how that breaks down, and I'm sorry, I can't find the name of the person who asked the question a few minutes ago. I think it was Debbie, D-E-B-I, Debbie with an I, so that producer Carrie can find that in the comments for us. But she was asking about the breakdown by county to help us better understand. So of this 10,000, it looks like 7,463. There's her question right there, Debbie. We're happy to answer it. 7,463 were in Maricopa County. Obviously, Maricopa County is the most populous county in Arizona. We're going to see numbers that are bigger here. Is that what you're seeing on the chart, Garrett? Yeah,
I'm seeing that. And there's also a discrepancy with what Maricopa has reported, because Maricopa today reported, and I'm just looking this up really quick, they reported 8,500. So as you can see, this is where things are sort of out of sync. They're about 1,000 off each other right now, the AZDHS and the Maricopa County Health Department. So yes, the majority of the tests and the cases that were added to the list today, to the report, came from Maricopa County.
Yeah. Will you click through just a few other counties,
so
more populous counties?
A little less than 1,000. Pinal County, 425. Yavapai County, about 136. Gila County, 73. Coconino County, about 55. As you can see, as we go away from the population centers, the numbers get smaller, except for Mojave County, of course, 278 right there. Yuma County has also been a fairly big hotspot, 481 in Yuma County. And in Santa Cruz, which has also been a hotspot, only 51 in Santa Cruz. So that's good.
Okay. I want to keep you updated on breaking news that's coming in as well. And Superintendent Hoffman here in Arizona just tweeted that today Arizona schools releasing a new statewide tracker to indicate whether schools are in distanced, hybrid, or in-person learning models. And Garrett, that address on Twitter is at AZED, so AZ Ed Schools, and that's where everybody can find that new tracker. But it's got a list of distance, hybrid, and in-person learning models, and this is so fluid. It's changing by the minute. I mean, we had some high schools shut down this Monday because they didn't have enough teaching staff there. Then some high schools saying, you know what, we're not going to get that staff back. They're in quarantine. We're not going to have those schools back open. So this is affecting a lot of people who work there and a lot of people who have kids and grandkids in school right now. So there are several tweets coming out from the superintendent right now, but I wanted to update all of you on that you can now find that tracker. Do you have it handy, Garrett, so we could show everybody where that is?
Already ready to go. So let me just bring it to all in all, because I was just clicking through it really quick. So this is all of the schools, it appears, in Arizona, and it's got it by the county and by what status they're in. So I'm going to go to Maricopa County, and we'll start with in-person. They do have 2 for in-person here. It looks like it's a database error. They'll probably fix that soon. Here we have, this is the remaining schools that they have in person. Just these look like most of these are charters. In fact, they all look like charter schools. So that's the charter schools. You've got a hybrid model. This is where you're going to see a lot of the other schools that are still sort of on the outskirts of the suburbs. You're going to see a lot of these in here. There's you can split through the list here, and then you can go to distance, which is the virtual learning, and these are the virtual learnings. You can see the basis schools are all in here. You see the majority of schools right now seem to be in the distance learning category. And then you can go to data unavailable. This is just that they probably haven't got reported, and they do have that, so that's good. In Maricopa County, there is data available for all schools, so that's good.
So it's just an easier place to find the entire list. We've got that address right there. I see some of you in the comments asking for that. So it's right there at the bottom of your screen. We'll spend a little more time on that a little bit later if we have some time. We just have so much to get to at this point. I also want to alert you to some other breaking news that's going to be coming out within the hour. The CDC is deciding who's going to get the vaccine first if and when it's approved later this month. So that's one of the things that we're tracking. As soon as we hear more, we'll update all of you on that. And I see producer Carrie's added that school tracker into the comments there for those of you to be able to find that. Garrett, let's move on to the hospitalizations. That is the big concern right now. On ventilators here in Arizona, we have 352 patients currently on ventilators. We have 579 patients who are in the ICU. So that is over, 800 families dealing with this situation. That doesn't include all the people that are hospitalized right now in Arizona. So help us understand how we look for hospitals. And again, the challenge in all this, as we found along the way this whole year, Garrett, we have tracked the different challenges, whether it's getting testing or getting the agents to process the testing. For a long time, we talked about how many beds there were, and now it's become a staffing issue. And if you have enough staff to care for these people in our hospitals. So let's at least take a look at how things look here in Arizona for our hospitals.
So I'll just use the ASDHS perch for this. This is something that most of us should be familiar with. I'm going to start with inpatient beds. This is just the general acute care beds for pretty much, anybody who has COVID-19 or just does not have COVID-19. That's the gray line right here. But here's the red is the COVID-19 patients. The grayish line is the non-COVID-19 patients. And you can see that our numbers of COVID-19 patients are picking up. They have been for quite some time. It's been a very pretty stable increase, as you can see, since about late October. You can see the hospitals are managing to maintain the same headroom, which means that what they're doing is, as COVID-19 patients come in, they're basically keeping the hospital. Once they're replacing a bed with a COVID-19 patient, it doesn't seem that they're adding someone else. They're trying to basically maintain a certain level, because, as you said, staffing is one of the biggest issues that they're having right now, not necessarily beds. So as you can see, and you can see that here, you can see in the first step up, you can see this increase in hospitalizations, is pretty, it's not as aggressive as the COVID-19 numbers, but you can see it's a pretty aggressive increase. And it didn't really drop down that much when the COVID-19 numbers went down, because they had to do elective surgeries and all this other stuff,
right?
That they because they were locked down for so long. And so now you've got a situation in which they're pressing upon each other. There's a bit more pressurized situation here, in which the COVID-19 patients are coming in, and yet they don't have the same amount of headroom. And so they're having to maintain that. And again, we don't know what this looks like in each county. This is only a statewide number. And you can see this at all the others as well. It looks the same with the ICU. It doesn't move up. It's very quick to move up for the headroom here, and then it's slower to move up because there were more people in ICU as more COVID patients come in. Our levels right now are at about late July, early August in all of these numbers. Emergency room beds, you can see there was a jump. We are seeing a leveling off of emergency room at this moment. Don't know if that's going to be maintained, but it is technically, I would say it's a leveling off since about November 18th. And again, we'll just have to see if that stays. So, and then we go to ventilators, like you said. We'll just look at that one really quick. You can see ventilators are also in sort of the region they were in late, middle of August is where we are as the amount of ventilator patients.
And Garrett, as we look at these numbers, I'm seeing a lot of questions about active cases here in Arizona. And to be specific, I'm seeing questions about recovery. So let's talk about the difference between recoveries and active cases. For people who are experiencing this, obviously it's a novel virus, new. And so there are long haulers. There are people who are still fighting this thing, even though they're past that sort of 2-week window of diagnosis and symptoms, and they're still feeling sick. So the only way we can figure that the cases in Arizona of 337,000 is to subtract out, sadly, those who we have lost here in Arizona who have died from the virus, and then sort of figure based on the collection date if they would still be active cases here in Arizona. So I want to help everybody understand that part first. Where does that number then get us of the 337,000?
Of the 337,000, right now we have an active case confirmed case count range of 50,000, 51.7 thousand to about 88.7 thousand. So anywhere from 50 to 90,000 people in Arizona are likely in the they're confirmed. They've had a confirmed test, and they are somewhere within what is possibly the infectious range of the disease in which they can pass it along. The others are already past that, so we don't know what the recovery numbers are. Like you said, Katie, we don't know who's a long hauler, who basically stopped. They didn't have. They had if they're younger, especially, they may have only had the disease for a week or so, and then their system took care of it. So there's people react to this thing very differently, but that's the best estimate we have as far as the amount of people who have an active COVID-19 infection in the state.
Let's see. I just saw a really good question about our hospital metrics from Debbie, and she asked, Garrett, do you know how many of our hospitals are included in the graph? Are all Arizona hospitals included in the information we're getting?
That's a great question, Debbie. The answer is they should be. And that there are discrepancies in which there are times that one or two hospitals, because these are all self-reported numbers, and there are times when, say, a hospital doesn't report that day and their numbers carry over from day to day, and they're not marked as reported. So there are times where reporting does go down, but oftentimes it is close to 100%. I don't think it is ever 100%. It's probably closer to like 98, 95%, somewhere in there. There's always going to be one hospital or two every day that doesn't report, but it's close to max.
Yeah. Some people are asking about the sports has become such a highlight of our conversations here as well, because coronavirus has directly impacted that. So people were asking about the 49ers using the Cardinals State Farm Stadium. As you may have heard, the 49ers players are going to be having their next two home games here in Arizona. They came to an agreement with the National Football League and the Cardinals, so that allows them to host their games here weeks 13 and 14 against the Bills and Washington's football team, though both happen out here at State Farm Stadium. So wanted to get you updated on that as well. A lot happening here in Arizona, a lot changing out in California, and the conversation here about making some changes for life here. The mayor of Tucson is talking about and proposing an 8 p.m. curfew in Tucson. That has not been approved yet, but we want to keep you updated on that. We have not heard from Governor Ducey. Garrett, have you heard anything about, I haven't seen his plans yet this week, if he was planning on speaking at all, but we haven't heard from him.
No, I haven't heard if there's any plans for Ducey to have a press conference.
As soon as anything comes out, as we have all summer, all winter here, kept you updated on that. So I know
what I can tell you is that we're getting close to a point in which at least one county is going to be, within the next couple of weeks, we're going to be in a situation where it's very likely that at least one county is going to be moved from the moderate to substantial, and that's probably a good time to speculate that the governor is going to have a press conference around that time, or someone's going to talk when we actually get that situation.
Right. Okay. So the other states that are really in this in the past 24 hours, because of the numbers that are just reported, obviously the holiday factors into this, are California, Texas, Michigan, Tennessee, and New York. Those were the big states with some numbers coming out over the last 24 hours. And we also mentioned that for those of you who are concerned about that 10,000 number here in Arizona, Illinois released its number of cases at 12,000. So that was double the number they saw the day before. So it just kind of puts in perspective what we're seeing across the nation as the holiday sort of messes with the reporting numbers. All of those will then be put into the collection date to help you better understand it. We'll continue to walk you through what all of that means. Okay, Garrett, as we talk about that, then this really affects our R-naught number. We should not really be focused on that as much today. When do you think that will become a viable number again, or something that we can?
I would probably give it till the end of the week in order for it to sort of settle. Right now, it's at a very low number. I don't even want to show it because I know it's incorrect right now. So really, we need to wait for about 3 or 4 days in order for the R0 to sort of correct itself from the holiday, because in the next couple days, because of this large 10,000, although it does do a good job of trying to account for reporting issues like this,
Mm-hmm.
having an outlier as large as this one
Mm-hmm.
is something that they may not have accounted for. So because of that, we could have an R0, in 2 or 3 days, it's going to show like 1.3, 1.4, and then it's going to go back down, and then it should start settling. What I see from the data that we have, and those numbers that I've shown you with the case numbers, I would say that our RT is probably still in that 1.1 range that it was prior to, when we talked a couple days ago, it was 1.14. It's probably still realistically in that range.
So somebody was just asking about the positivity test rate. Is that a stable number at this point when we're seeing these
yes,
shift
yes.
so much? Okay.
The positivity rate is stable. I would say, although not the reported positivity, because today's was over 50%, and
Mm-hmm.
I wouldn't use that for anything.
Because Garrett, what they're taking for that raw number is the 18,000 results that we had come in from Arizona. They're dividing the 10,000 into that, which is giving it an off number, because that's not really stable.
So it looks like there's sort of 2 reporting tracks. A lot of the negative tests were reported
Mm-hmm.
during Thanksgiving weekend, and then the health department, because they were understaffed over the Thanksgiving holiday, they weren't able to go through and verify the positives and input them into the system. So they've been input in the system now, and that's what the discrepancy is. That's why the 50%, like I said, it's not 50% of tests came back positive. That's just not the case. It's closer to 17%.
So how can you smooth out those anomalies? And is there a way to get us to a better understanding of how the number either looks by the whole state or by the counties?
Sure. So the best way of doing it for just anybody who wants to look at what the percent positive is likely close to right now is again the ACDHS dashboard. It's the most accessible area you're going to find for this. We're going to find the laboratory testing, and we're going to go down here to these lines right here. I know they can be a little hard to see. They're done by week right now. And you can see this is Arizona's epi curve percent positive by week. And you can see right now this one's at about 14%. This one's at about 23%, but it's probably going to change. You can even put this into days. Oh, wait, I just put it into months. That's not what I wanted to do. You can even put this into days. A little hard to see, obviously, but you can see when I'm talking about that 17%. You can see that's what I'm getting right there around this area. A lot of these were about 17%. So we are increasing, even though it's only saying 13%. We are going to 17%. We're getting closer to that 14, 15 per week. We'll see what happens next week. But again, our percent positivity rate is not slowing down at this point.
And it looks like some updates are coming in from the CDC. The panel is either getting ready to vote or they just voted on how these vaccines will come out. So I'll get that information in and then get you all updated on that as well. Garrett, are people moving around a lot more? How do our mobility numbers look? We have not checked that in a while. And I believe, correct me if I'm wrong, mobility really shows if you're leaving more distance than 20 miles from your home base?
It depends on the methodology by each company, each person who's measuring.
Okay.
But they usually have some sort of denominator like that, where it's, if you stay within a 10-mile period, you're still marked as staying in your area. But if you move outside of that, then you're marked as sort of traveling. And I don't know what the exact number is. Sometimes it's 10 miles, sometimes it's 20 miles, but they have that number there to tell you what it is. And I did find an interesting dashboard I'll share with you. This one's done with Facebook data, and I have it shared right now. And you can see this is what's interesting about this data right now is that we are seeing significantly lower movements for the Thanksgiving holiday right now. You can see this is going up from November. This is all the counties, but you can see all the counties sort of collectively are going down for that week of September right now, or that week of Thanksgiving. We can view this as a separate chart, and we can see this pretty much in all of the counties, including Maricopa right here. You can see all of there's this massive downward movement in these numbers. So that's just something, and I picked that up on my charts as well, a downward movement as well. So we are seeing people, at least for the Thanksgiving holiday, there wasn't as many people traveling as, say, one would have expected. At least in People may
Yeah.
have been coming to Arizona, but it looks like Arizonans didn't move as much. I mean, even if you just account for travel time on November 25th, because obviously when people get to Thanksgiving, they're not going to, they're not going to leave on Thanksgiving. That's why that number is so low. But even right here on the 25th, if you look at these numbers, they're not that different from each other for the week leading up to the 25th, or the 26th. So not a lot of movement, which was, I guess, you could say is good.
So I can update you on what the vote looks like. And we were just saying this minutes ago. The CDC has just voted 13-1. So not a big shocker here to recommend that both healthcare workers and the residents of long-term care facilities are going to be the very, very first ones in line to get the coronavirus vaccines that end up getting that emergency authorization. That's what we're all waiting for from the U.S. Food and Drug Administration. So again, not a huge shock here, but both healthcare workers and the residents of those long-term care facilities are going to be the first ones, and the vote was 13-1. That just coming in moments ago. So a lot of conversation about in what order do we allow vaccinations to be out there for folks, and who gets in line first.
Yeah,
Okay.
as you said, that's not a surprise. They've been
Yeah.
talking about that for quite some
Yeah.
time. It was going to be
Um,
the LTCs first.
Exactly. So if we hear anything more on the votes beyond that, we'll of course keep you updated on all this. And just as far as that goes, Garrett, I mean, that is where we've lost a huge chunk of Arizonans as well. I believe it's about 1,300 Arizonans who we've lost. Of the 6,600 were in long-term care facilities here in Arizona. So it really shows how this group of our community was the hardest hit by far.
And we talked about this a little bit when Steve was covering for you yesterday, in how, one of the reasons why the death numbers now are not rising as much as they were, or aren't as high as they were in the first surge at this moment, is that we're not seeing the same amount of deaths that are happening in long-term care facilities. Back in May, June, July, we were seeing a significant amount of deaths coming from long-term care facilities. At one point, it was like 70-80% of deaths in Maricopa County were coming from long-term care facilities. And then that started to go down because there was more deaths in the community, sadly. But right now, deaths are fairly low for both the community and the long-term care facilities. But again, they're remaining low for long-term care facilities, which is great because this is by far the most vulnerable population. And you don't want to see COVID getting back into the long-term care facilities. That's for sure.
Yeah, absolutely. I'm seeing a lot of heated comments in the comments, and I just want to remind all of you, if this is too stressful for you, if this is too much for you to listen to, and it's making you upset, then that's probably the time to back away from the computer and not get in fights with people about this, because really this hour has always been, since we began, about understanding these numbers and understanding the data so that you can make the best decisions for your family and your life. But if you're getting in a fight, it's with someone so heated in the comments that you're feeling it, time to back away. This will be here. We post this to YouTube, and it re-airs in the evenings at 7 p.m. on your favorite streaming devices. So you can get this information and understand this stuff a little later when you're not so upset. And you can even direct the comments at me. It's okay, Alexis. It's okay. I'm seeing some of these people in the comments. It's okay to be mad. I understand. This is a very heated, upset, scary time. So just take a breath. Take a breath. Don't fight with someone in the comments. It's not worth it. Not worth it at all. All right. Okay. So Garrett, the making sure that we get these vaccines out to everyone has been such a huge part of this conversation, and making sure that people are able to get it. A lot of these come with 2 doses. We've talked a lot about the refrigeration requirements at negative 94 degrees, that this is a logistical challenge, to put it nicely, to try to get this out to everyone. There is a timeline for looking at these things. December 12th and December 11th is when we're hoping to get some kind of answers, and also get some kind of methodology to be sending this out to everybody. There's also, though, at-home kits out there, which are like 30-minute tests that would cost about $130 or $119, depending on where you order them from. You'd literally be able to test and then get in the shower. These would be for people who couldn't necessarily get the vaccine for a while, have a long wait, but that still are around people they want to take extra precautions for. So that's why these at-home kits have been popular for those folks. So wanted to keep you updated on that as well. All right, Garrett, what are some of the other things that maybe that you all didn't get time for yesterday? On a highlight on all of this, they're adding the fair food back in. And I mentioned that because it's been such a popular thing, the drive-through, to still be able to celebrate different events throughout the Valley. And they had that over when we had the fair, and we would have had the fair, and they wanted to celebrate it in some way. It's been so popular, they're bringing it back. So people are finding workarounds. People are finding ways to still celebrate life through all of this. Just wanted to mention that it is coming back. So
let's just go through some of the places to see some of this data as it comes in, the reported data especially, because you can't see the reported data in chart form on the AZBHS. So we're going to spend a little time with Johns Hopkins University's website. I'll pop that up here. And this is, I think producer Carrie has this. This is the critical trends for Johns Hopkins University. You can see all the data here for all the different states. And we're going to go to Arizona right here. This is the reported curve. You already saw this. It's a day behind me, so that's why it doesn't have the massive spike yet. But if you ever wanted to see what the reported numbers look like, you can go here and see these numbers in a much easier format instead of just my report I do every single day. They also have that map that everybody is very familiar with. This is literally the first tracking dashboard that was available for COVID-19 was this COVID-19 Johns Hopkins University map, and it also has a U.S. map as well. They also have this very interesting, and this is where I think Katie comes here every once in a while because you point out the top 50 cases confirmed by county, and this is where Maricopa does show up because it is a large county, of course. Yeah. So it will show up right now. It looks like it is fifth, fourth.
Yeah, and it is the fourth most populous county in the nation. Yeah. So that sort of matches. We've seen it as high as the second.
Yeah. Mm-hmm. Yeah, it matches where it should be per capita in that respect. And then it's got all this other data you can look at here. I'm not going to spend too much time on this map specifically, but just to know that it's always here. And then they have this very interesting data in motion. I think you and I talked about this once, where it actually shows sort of how the data shows up. I'm going to try to mute it and come to an area where you can see this data moving, which is very interesting. This is where it will show how Maricopa, where it started 14 days ago, and you can kind of see where things are moving, where hotspots are coming in the area. Very cool little YouTube that they put together every single, I believe this is every day they change this data. So
yeah, it's updated each day.
Yeah. Mm-hmm.
Yeah, it's just a great way to watch it sort of in motion. And
yeah, good way to see it in motion and see where things are happening and just give you a really quick snapshot of what's going on. And then they also have information on testing here. I think we've shown the testing tracker here for all the states, showing where things are. Right now it says 822. It's going to say 10,000 tomorrow. Mm-hmm. But this is where it is right now. That 19% positive, like I said before, that's actually a little closer to where it actually is. We've had times when this was there was a lot of discrepancy, but 19%, like I said, it's closer to 17%, but 19% is pretty close. So.
Yeah, so just another helpful tool in tracking all of this. Let's see, Marcia just wrote a minute ago. She says, yay, so glad care centers will start protecting their staff. So yeah, it's going to be one of the first places that vaccine is rolled out to. So thank you for weighing in on that. Garrett, as we look at some of these projections, I know that these numbers feed into this, and I don't know which day the IMHE was last updated. Obviously, I've been away from the holiday.
Disappointingly hasn't been updated in a while. So
it still hasn't. Okay, well,
19. Let me see if I can find another one while you're talking.
I'll let you take a peek at that, and I want to just update you. Doug Ducey just tweeting just minutes ago. He's writing, "We are grateful to our medical professionals and hospital staff working around the clock to care for Arizonans. Thank you to all hospital leaders who joined our call to provide #COVID-19 updates. We will continue to work together to ensure hospitals across the state have the resources and support they need to treat Arizonans during this pandemic." And then he's tagging all of our major hospital providers: Banner, Dignity, Honor, Valleywise, Abrazo, and Mayo Clinic. So that is the only way we've heard from the governor, is through the Twitter account. And then also we are getting some video updates that have come through YouTube and some other places from the health department. But those are the only channels that we've seen them talking through at this point. Again, if we see an update, we'll pass it on to all of you.
Okay, I've got a forecast I can show you. This is the CDC's forecast hub. I don't use it as much as I do the IHME because it goes out a little farther. But we'll see what this one looks like. This is using what's called the ensemble forecast. So it's basically an average of all of the forecasts. And we'll start with incident cases. As it pops up, there it goes. Okay. This is basically what it's saying. I believe this is, it looks like this is weekly. Yes. So it's showing what they think is going to happen during the week. It does think that we are coming to about, looks like 3 weeks ahead. So about 3 weeks from now, this is when it believes that we're going to hit our peak about 2 weeks from now at about 30,000 cases, 31,000 cases, and then we're going to start going down as far as the incident cases. The incident deaths, as we've talked about, because deaths do lag cases, it does believe that we will increase. This means that there is no peak yet. They don't know when they're going to start going down because they're only going out 4 ahead, and it's continuing to go up. And then as far as cumulative cases, that's obviously going to continue going up because it's cumulative. So this is, again, viz.covid19forecasthub.org, and this is a CDC site. Again, this is what's called the ensemble forecast. So it's basically all of these forecasts averaged out, but because of that, they kind of try to keep it, as low as possible. So they try to not bring it up too far.
So Garrett, when we're seeing these forecasts 3 weeks out, unfortunate and very sad timing and all of that as we get closer to Christmas, but this is not unlike what we saw after Thanksgiving in Canada. Obviously, their Thanksgiving is earlier than ours, so we had a bit of a preview on how things went there when people got together, and then we saw the increase in numbers in Canada. So we're kind of expected to see the same sort of thing here in the next few weeks.
Yeah, correct. I think you'd expect to see some sort of increases, but again, it's about magnitude, not increase. We already understand that there's going to be an increase. So what is the increase going to look like?
Yeah.
And, again, this 10,000 we saw today, as we've talked about, we know that this is not, what happened over the last couple of days. This actually is closer to what happened, 4 days ago, 5 days ago. Mm-hmm. So, if you kind of, like I said, if you average it out, it's still sort of within the range of where we were last week as far as when we were reporting cases. Still high. We're still hitting a peak, but we're not at 10,000. Just so everyone knows, obviously, the state did not report 10,000 people getting COVID-19 yesterday. That's just not how it works.
Right. It's all plugged into that specific date. So I think you might have kind of answered that there. Kimberly's question just a few minutes ago, basically, how will the numbers be down significantly then tomorrow to level out, or would we expect them to be higher? We don't really know at this point.
No, I'm expecting probably around the 4,000 to 5,000 range right now for tomorrow, because that's sort of where we were, and that's if you averaged out this 10,000 over a period of like 3 days. That's what it comes out to.
Right.
So I would expect it's going to be around that as well.
Okay, so we were talking about the decisions coming down on the vaccine. I mean, that's what everybody's waiting for. The UK could have their decision as early as this week, and then, as we've talked about, the deliveries would begin within hours. For us here in the United States, the FDA is meeting on December 10th, so we are 9 days away from that. That first vaccination then could start as early as the 11th. So just to keep you updated on that time frame as we wait for more info to come in on that. We're about 9 days out from that. So we'll, of course, keep you updated on that. And Garrett, let's see. There was one more thing I was just about to ask you about. The hospitalization numbers, they're reported in real time.
Yeah, they're reported from the night before. So that's why they weren't subject to the reporting lag from the holidays. Could there have been 1 or 2 hospitals that neglected to report yesterday? Absolutely. We talked about that. Every once in a while there are hospitals that don't report, but no, they would have, those numbers that we saw and that we're tracking are as close to what we would normally get anyway.
And then does this affect, I believe it's on the county site that it shows us what percentage of people end up in the hospital. Now, it's not a statewide number that we have, but for that particular one, we see it between 11 and 8% pretty much for the past few months. the reason this is important is because you take those 10,000 cases, then what does it say today?
It's at 8%.
8%.
And I would expect there to be a lag in this as well, because the priority, what I've seen is for AZDHS, it appears their priority is getting the case curve up to date first, and then the hospitalization curve. So there could be a little bit more lag in getting this hospitalization curve up to date. But I doubt that it's going to change that 8% number. We're so far into the pandemic at this point that sort of changing of the cumulative aggregated statistics, it's very difficult. It doesn't happen that often. I mean, for example, just to show you the summary screen, we don't talk about this that much, but this diagnostic percent positive, 10.6%, that has been increasing. It had been dropping for several months. It is increasing right now, but it increases very slowly by a tenth of a point. I think I have 10.5 yesterday, and although I was taking a Thanksgiving holiday, so I wasn't recording it, I have 10.3 on 11/25. So it's only increased by 0.3 of a point in that time period. So it just doesn't move very quickly. Most of the aggregated statistics at this point don't move very quickly.
Yeah, the shift doesn't happen as much because you're looking at the life of the pandemic.
Everything. You're not looking at what's happened last week or in the last month or so. Now you're just looking at everything, so you're not going to see a lot of change there.
Yeah. We were getting some just last minute questions on the flu in Arizona, so I'm happy to update you on that as well. Now, keep in mind, they break it down into 5 categories. So it can be widespread, regional, local, sporadic, or no activity. We're at sporadic. So we have 43 cases as of December 1st of the flu here in Arizona. Usually at this point, we would have about 300, between 150 and 300. So that sort of puts it in perspective for everybody asking that question. We're only at sporadic, and that could be because so many people are wearing masks. So just want to get that question answered, and we're pretty much out of time for any more questions. I'm seeing a bunch. We'll get to them tomorrow. I'll jot them down, and we'll get back to you on some of those because we really haven't seen the numbers yet from Thanksgiving. So if somebody was infected on Thanksgiving, they will only start to see symptoms and go get tested at this point.
Yeah, I mean, really, what is it? It's how many days after Thanksgiving now? It's
Thursday, so Friday, Saturday, Sunday, Monday.
Seeing right now, if someone's seeing symptoms from COVID-19, they're testing right now in the next, from yesterday to like the next 4 or 5 days. And we will see that data about 3-4 days after that. So really, it's going to take us a week to see even the beginning of what could have happened during Thanksgiving. So we'll see what happens. I mean, that's all we can do.
Okay, so that puts it in perspective for everybody. That's going to be all the time that we have this afternoon. We will be back here with you tomorrow, same time, same place. I want to let everybody know where you can find updates pretty much in the morning. They come out from your Twitter account, from all the things you're computing there, Garrett, and you can find his Twitter account at Garrett_Archer for a peek at how the numbers look in the morning. You can find my Twitter account at Katie Rammel. If it's preferable for you to contact us on Facebook, my Facebook is News from Katie. Had to think about it for a minute. Facebook.com, News from Katie. Thank you for all the nice comments. You are so welcome. Hopefully it helped you better understand what that wild 10,000 number meant and how we can make sense of it here this afternoon. And let's see, we will be back same time, same place. All of our reporting on coronavirus can be found at abc15.com/coronavirus. Remember that site for schools? We'll make sure we get it linked on our site as well so you can find it easily. It's abc15.com/schools. That's where we've kept a list of schools closing and going back to hybrid and changing their plans on the fly. We've kept our list there. We'll make sure that we link the list that we told you about earlier in this hour right there. And our newscasts come up at 4 in just a matter of minutes, 15 minutes. 4, 5, 6, 9 and 10 p.m. So a lot of opportunities to catch our reporting throughout the afternoon, throughout the day. And we'll invite you back here tomorrow again, same time, same place.